Dear all, thanks for having me. Today, my topic is expanding syphilis test uptake using rapid dose self-testing for syphilis and HIV among Chinese men who have sex with men. This is a disclosure. This is the outline for my topic. So firstly, let's take a look at the syphilis epidemic globally. In 2012, there was an estimated 5.6 million new syphilis infections globally, and 410,000 were in China. MSM are disproportionately affected by syphilis. The estimated incidence of syphilis among MSM was 9.6 per 100 person years between 2006 and 2012 in China. Expanding syphilis testing is a cornerstone of syphilis control. Currently, facility-based syphilis testing is the main way for MSM of accessing syphilis testing. However, syphilis testing remains low among Chinese MSM, which is much lower than that of US and Australia. Barriers preventing MSM from accessing syphilis testing include stigma, lack of privacy, and inconvenient testing systems. The advantages for the SST include privacy, time and location, reaches people who do not test in facility-based testing. It also has several disadvantages for SST case, including the physical violence, psychological issue, and quality of test case. Now the syphilis self-test kits are available on e-commerce platforms, or people can get the SST kits through existing syphilis self-testing programs in China. There are 10 different kinds of brands of SST kits on the two largest e-commerce platforms in China. All the test kits used blood to detect treponema-specific antibodies. And all the test kits were approved by CFDA with excellent sensitivity and specificity. The cost of a test kit ranges from $2.5 US to $15 US. The shortage for the syphilis self-testing case, which is also different from the HIV self-testing case, is that it cannot differentiate between current and past infection, which might lead to overtreatment. Also, for people with reactive results, how to link them to confirmatory tests, treatment, counseling, and follow-up is a key problem. And to date, there is quite limited study about the SST. So the existing gaps to date include what's the current status, acceptability, feasibility, and the influencing factors of SST among MSM. What's the effect of SST on follow-up treatment and counseling? So my team designed a study plan for the SST study. Firstly, I'm going to introduce a national cross-sectional study. It's an online study, which was conducted in July in 2018 among Chinese MSM in 103 cities in 29 provinces. The implications of this cross-sectional study include SST can help expand syphilis testing among MSM in China and in other countries that have established HIV self-testing infrastructure. Incorporating SST into HIV self-testing service has potential to achieve the maximum benefits of dual elimination of HIV and syphilis among MSM. The acceptability of SST is good among Chinese MSM, but 3/4 of MSM in our sample have never used SST. For more details, you can find our published papers in the Journal of Clinical Infectious Diseases. So based on our findings of the cross-sectional study, our team further conducted randomized control trials to explore the effective strategy on promotion SST among MSM. Briefly introduction for this RCT. In this RCT, we set up 3 different groups. For the control group, we recommended participants to get free syphilis testing at their local CDC or STD clinics. In the standard SST group, besides measures in the control group, we also provide delivery of 1 self-test package after randomization based on application. For the lottery SST group, besides the measures in the standard SST group, we also provided a lottery draw for 10% probability to win 100 RMB if they self-test and report result to the platform. In terms of the procedures of the lottery draw, we used crowdsourcing method to conduct a crowdsourced lottery contest to determine the procedures of the lottery draw. This slide is to show the SST package. So the SST package was sent to applicants by postal mail. And the package included the manufacturer's supplied step-by-step instructions, a web link to an instructional video, and a result report card. The result report cards allowed participants to upload a photo of their test results to verification platforms by scanning a barcode on the card. And the barcode which were uniquely linked to the study participants. Okay, these are the procedures for the 2 SST group. Firstly, the participants have to apply the case if they want to get a SST case. Then the research assistant of my team will mail the syphilis self-testing case to the participants. The participants who received the SST package could see the usage introduction and doing the self-test following the introduction and reading the outcome following the introduction. If they like, they can upload the photo of the outcome to a designated platform to get an incentive price. For the participants with reactive results, our research assistant will provide information on how to get linked to care. For the participants in the lottery group, if they upload their results to the platform, they can apply lottery. So we totally recruited 451 in this RCT, and the recruitment happened between January 9th, 2020 to July 17th, 2020, and the follow-up is maintained 6 months. The eligibility for this RCT is that a male with 18 years old and above had unprotected innocence with another man in the past 12 months, reported not testing for syphilis in the last 6 months, not living with syphilis or unknown syphilis infection status, plan to live in China for the next 12 months, and willing to provide address where they can securely receive package. And the recruitment platform is a Blue D. We also registered this RCT with a clinical trial number. The primary outcome for this RCT is to examine the proportion of syphilis test uptake, either with self-test or at a clinic. It also has several different secondary outcome, and the most important one is to examine the cost effectiveness of SST comparing with standard of care. Okay, this is a flowchart of this RCT. We can see that the retention rate of this RCT is over 80%, which shows a good retention rate. So all the participants were recruited from 124 cities in 26 provinces in China. Now let's see the main findings of this RCT. So the proportion of MSM tested for syphilis in the SST group was significantly higher than that in the control group. This result is similar to the participants in the lottery SST group, comparing with control group. However, no significant difference was found between lottery SST and SST group. Among the participants who undertook the self-testing, we found that 78.5% self-testers were first ever syphilis test. We can see from the table that participants in the lottery SST group have the most frequency of doing syphilis testing, comparing other two groups. And in this RCT, 5 men were newly identified with syphilis in this study. And all the 5 men self-reported that they received further confirmatory testing and treatment. This is the economic evaluation. We can see that the cost per person tested in the control group is $66. For the SST group is $26. The lottery SST group is $28. The incremental cost per person tested for SST compared to control was $17. So this study highlights the benefits of SST from a cost effectiveness standpoint. This is the main findings for this RCT. So RCT can help expand syphilis testing among Chinese MSM, and most of the self-testers were their first syphilis test. And we also found that syphilis self-testing is cheaper per person tested compared to facility-based testing. And compared with SST, lottery SST can increase the frequency of syphilis testing uptake. This is the implications for this RCT. So our study provides evidence that compared with the standard of care, promoting syphilis self-testing could significantly increase the proportion of MSM testing for syphilis and is cheaper in China. But we also need to pay attention to the limitations for this RCT. The first one is that the impact of COVID-19 restrictions may have accentuated the demand for decentralized testing. However, an online survey in China estimated a 59% decrease in the number of MSM undergoing facility-based HIV testing during COVID-19 pandemic. We did a sensitive analysis and found a little change to the original results. Though we use an objective measure for our primary outcome, there is potential to underestimate the number of people testing for syphilis if they did not upload their syphilis test results. We have data from Treponema test results, but not non-Treponema serologies. Future studies to evaluate the cost of scaling up this model and the long-term impact on syphilis epidemiology is warranted to confirm the value of syphilis self-testing. Okay, I would acknowledge many of my study team members and many collaboration institutes and several NGOs. Thanks for your attention. Thanks.